Surgical infections have become a major concern for healthcare institutions worldwide. Professionals in the operating setting constantly find ways to reduce the incidence of surgical site infections by targeting processes in the preoperative, intraoperative, and postoperative periods. For the intraoperative processes, gloving and gowning remain significant factors to contend with. The World Health Organization recommends the use of powder-free surgical gloves not only to reduce infection, but also to minimize adhesions and inflammatory responses. Closed-hand gloving is preferred to maintain the sterility of the conditions. It is our goal to teach correct surgical, gloving, and gowning to medical and nursing students as well as young professionals in the operating room to ensure that minimum, if not zero, infections occur in the OR.
In behalf of Operating Room Nurses Association of the Philippines Incorporated, or NAP, as one of the frontliners of safety in the surgical field, we would like to uphold our life purpose, which is to promote the highest professional standard in perioperative nursing. Through the best practices of surgical gloving and gowning, alongside the proper hand hygiene, we maintain the sterility in the operative field without compromising not only the patient's safety but as well the healthcare providers. Surgical gloving and gowning protects the staff from blood and body fluids, including contact with the mucous membrane and non-intact skin. When it is indicated as contact precautions, surgical gloving reduces the risk of transmissions of infectious agents to the patient environment and other patients. This way, healthcare professionals are focused and confident to deliver best quality of healthcare each patient deserves. As advocates of health, we promote and ensure safety, yet we must always remember all the time to protect the hands that heal.
Recommended method for surgical gowning. Ensure hands are dried aseptically after surgical hand washing. Place right and left hands under respective flaps with size stamp facing chest. Slowly open arms and allow the gown to unfold toward the floor. Slide arms into sleeves as far as possible, without compromising sterile technique. The individual donning the gown should be assisted by a scout nurse who ensures adequate fit by pulling the gown over the shoulders. Secure the inside ties of the gown first and then fasten the Velcro neck closure. Don gloves through closed gloving technique. To secure the front tie, the gowned individual should hand the transfer tab to the scout nurse. Secure fastening the wraparound belt. The surgical team should take precautions to avoid contamination and maintain the sterile field. The hands should be kept above the waist and in sight at all times. The sterile areas are the front of the gown from the table level or sterile field to 2 inches below the neck, the sleeves from 2 inches above the elbow to the cuff, the surgical gloves. Recommended method for closed gloving. Do not slip hands through the gown cuff. Hold the cuffs in the hand. The glove pack is opened by the circulating nurse. Grab the inner wraps with the fabric of the gown, ensuring the hands are kept inside the gown sleeves. Open the inner wrap, ensuring the hands are kept inside the gown sleeves at all times. Pick up the first glove with your dominant hand. Gently flip the glove over, so the glove now rests on your right or left forearm. Using your other hand, which is still inside the gown sleeve, pull the edge of the glove over the back of your hand. Wriggle fingers and thumb into place as gown and glove slide together up your arm. The glove is now fully on. Pick up the other glove with your ungloved hand. Flipping the glove over onto your forearm, and glove this hand in the same manner. With both hands fully gloved, you can attend to finer adjustments of both gloves, eliminating risk of contamination.